The road back to reopening, together, committed, safe. This is Lisa Dyer, Director of Advancement with Timothy Christian School, coming to you with a special presentation on medical updates in children regarding COVID-19. We are pleased today to offer this presentation by Gladibel Medina. Dr. Gladibel Medina is not only a pediatrician and child abuse specialist, but she is a beloved Timothy Christian School parent. Gladibel.
Thank you, Lisa. Hello, everyone. The following is going to be a brief overview regarding what is currently known of COVID-19 infection in children. The information that will be provided to you today comes from the CDC, the New Jersey Department of Health, and the American Academy of Pediatrics. To begin with, let's talk about COVID-19. The acronym stands for Coronavirus Disease 2019. Coronavirus, it's termed that way because under the electron microscope, it looks like the virus is surrounded by spouts, a crown or corona, thus the name. Coronaviruses are not new to medicine. They actually have been around for a little bit, but most of them cause mild respiratory disease in those affected. Exposure to coronaviruses generally is common in early childhood with subsequent immunity or immune response. What that means is that potentially you can be protected from future coronavirus infections later in life. COVID-19, however, is caused by a brand new coronavirus, sometimes referred to as a novel coronavirus. It has been identified as SARS-CoV-2, another acronym that stands for Severe Acute Respiratory Syndrome Coronavirus 2. And that name is completely scary for sure. However, the majority of the cases of this new virus, as it causes illness, it's not severe. The severe disease occurs primarily in the elderly population and those with underlying chronic medical conditions, such as lung disease, cardiovascular disease, or immunosuppression. Now, keep in mind that this topic is very fluid as data is continually changing as increasing knowledge is gained in this subject. So what we are going to present to you today might be a bit different in the upcoming months, but hopefully it won't change too much. Let's talk about the symptoms of COVID-19. They're not unfamiliar to us. They include fever, which is defined as anything greater than 100.4 degrees Fahrenheit, persistent cough and congestion, difficulty breathing, sore throat, headaches, body aches, loss of sense of smell or taste, nausea, vomiting, and diarrhea. As you can see, these are symptoms that we are all, as caretakers, very familiar with in the illnesses that our children are impacted to on an annual basis, right? Except for perhaps the losing the ability to smell or taste, which appears to be a little bit more specific for coronavirus disease, COVID-19. The rest of the symptoms are something that we are all very aware of. And unfortunately, then, that makes it a little bit harder to determine whether when our children are sick with these symptoms, do they have COVID-19 or is it something else? And in the majority of cases, it's going to be that something else that we are routinely used to, such as sore throats, pharyngitis, strep throats, seasonal allergies, common cold, flu-like illness, gastrointestinal disease, food poisoning, etc., etc. But it's good to keep this in mind because these are the things to be mindful when our children are not diagnosed yet, and we want to protect those vulnerable loved ones. We don't want the children to come and be in contact with other groups when these symptoms are present. All right, when we discuss prevalence and severity in children, we're basically asking how common is COVID-19 in this population and how severe is the disease. And when we discuss children, we're talking about birth through about 17 years of age. That is the definition. That is how much of the data is gathered in the institutions that actually monitor for this disease. The good news is that COVID-19 is less prevalent, so not as common in children, and less severe. Severe disease is actually very uncommon in children. Of the total number of cases in the United States thus far, and this is through the beginning of July 2020, there have been about 3 million plus positive cases of COVID-19 in the population. Of those positive cases, about 5 to 7% are children, depending on the data that you're referencing. That amounts to about 165 plus thousand kids. When we talk about New Jersey specifically, there have been about 175,000, again, to the beginning of July, 175,000 infections, and children make up about 4,600 of those cases. Of the children that have actually been infected, about 179 have been hospitalized. A lot of these hospitalizations are, of course, for monitoring, reassurance, and the highest age group that we see in the hospitals are infants. There have been reports, as I know you guys are aware of a rare complication of COVID-19. It has been named MIS-C, and that is another acronym that stands for multi-system inflammatory syndrome in children. Again, a very scary name. It basically refers to inflammation of internal organs, which can be bad, can end the child in the hospital. Outwardly, what you would identify as a sudden fever that might increase over 24 hours to high levels. You might see conjunctivitis, or what we call pink eye. You might see a rash on the skin. The child just doesn't look well, feels ill, and in some cases you might have swelling or redness of the hands and feet. Of course, again, it's a rare complication of COVID-19 in our children. It usually affects older kids, as opposed to a similar condition that we see caused by some other things in the younger population. But in New Jersey, about 42 cases have been reported of this condition. Only 2 child deaths have been reported in New Jersey, and this involves the age group of 4 years and under. Thankfully, no deaths have been reported in New Jersey in the age group between 5 to 17 years, which is the majority of our elementary, middle school, and high school children. So thankfully, no death in this age group. If we want to put COVID-19 in perspective, let's compare it to another virus that we're very familiar with in our children, influenza. So influenza versus COVID-19. COVID-19, as we have seen so far, it's very mild disease in our children. Influenza is actually much severe, and it's something that we have to worry more when we're talking about our kids. The data I'm going to use today encompasses influenza season from 2018 through 2019, which the data have been well established for that. The influenza season is about 5 months, and that's pretty much what we have experienced so far with COVID-19, a 5-month period. And if we take that into consideration, look at the prevalence of disease. So the first bullet, we see that influenza cases in children, about 11.3 million have been affected in that 5 month season, compared to COVID-19, which is about 165,000 plus kids. In terms of death, for influenza, we have about 477, and that's a huge number. For COVID-19, we have about 58 deaths reported throughout the United States, with 23 states reporting no death at all in children. In terms of severity, or of course hospitalizations, we don't want our kids in the hospitals. For COVID-19, there have been 1,780 about. For influenza, last season was 46,000 admissions, over 46,000 admissions to the hospitals. The mortality for these two viruses, thankfully, is pretty much the same for both, with COVID only 2 deaths reported in New Jersey, and for influenza in that season, then 6 deaths. So we can see that influenza is something that has been with us for a while, and it's definitely much severe in terms of our kids, and we have come to handle that pretty well. COVID-19, thankfully, does not affect our children as significantly. Disease is mild, and then the rare cases, of course, are always present as with any other medical condition, and we just have to be mindful of that. So if COVID-19 is not as harmful for our kids, what is our worry? Well, as I said in the beginning of the presentation, our worry is that vulnerable population. We don't want our kids to be the ones to transmit in the event that they do become infected and expose those older individuals that we love and those that have significant medical conditions. So we have to have a plan, and we have to have an understanding of how this virus is transmitted. So how is COVID-19 transmitted? Transmission or entry into our bodies occurs through our mucosal surfaces, right? In our mouth, our nasal. Infected with COVID-19, the virus has to enter your body through these routes primarily. There are other routes that we're not going to discuss in this presentation because they're not applicable to daily exposure outside or in schools. And again, information is not very well documented for those other topics. But just keep in mind your face, so your eyes, nasal passages, your mouth, anything you eat or put in your mouth. How does transmission happen? Transmission of COVID-19 occurs via unprotected, close contact with respiratory droplets. So respiratory droplets is that fluid that comes as you coughing or sneezing, which is primarily saliva, and secretions from your respiratory tract. For you to transmit the virus, the person has to be infected, of course, with COVID-19, and the virus has to be inside these respiratory droplets. If you were to have someone infected coughing on your face, sneezing on you, contact can happen because it's going directly through your eyes, through your nasal passages, your mouth. When you share or drink from the same cup, you can also come in contact with this virus from the infected person. When you're sharing utensils, the same. And of course, we always worry about transmission from objects. First, keep in mind, the objects have to be contaminated. Contaminated with what? Were someone coughing, sneezing, talking and spitting? The droplets have to fall somewhere, right? Usually in the surrounding vicinity. And then you have to touch the contaminated surface and then bring that virus into your eyes, your nose, and your mouth. Exposure to the saliva, of course, the CDC defines it as when you are standing less than 6 feet from the person, you are at increased risk of those droplets reaching you. And then how long do you have to do that for? Well, you usually have to stand next to that person for a period of greater than 15 minutes as per the CDC, but the New Jersey Health Department uses the 10-minute rule. So if you stand around someone who is sick, coughing, sneezing, less than 6 feet, for more than 10 minutes, the chances of you coming in contact with one of these infected droplets is higher. Not so much for everyone who is keeping their distance and not around the person. So remember that transmission is through respiratory droplets, contaminated surfaces. Again, you have to bring those droplets that are on the surfaces into your eyes, nose, and mouth. And then that would have to enter your body. If you actually touch a contaminated surface and then you will not be infected with COVID-19. The virus does not transmit to you by just standing next to a person, even if that person is infected with COVID-19, right? If you're standing next to a person, you're passing the person less than 10 minutes, you're not going to get COVID-19. Very rarely would that happen. The virus does not go through clothing. It's not like going through the skin, especially intact skin. That's a natural barrier that we all possess. It doesn't go there. If you're sitting on a chair that somebody with COVID-19 who's infected with COVID-19 sat on, the virus is not going to enter your body through your skin. You actually have to touch droplets in the contaminated object and then bring those droplets into your eyes, nose, or mouth for you to acquire the disease. The virus does not jump from person to person like other diseases we know, or objects to person. So entering a room where there was COVID-19 on a surface, unlikely to transmit the virus to you. So how do we prevent it? Now we know the entry route, our face primarily, right? What do we do to stop that, to decrease the risk of any of us, including our children, getting the virus? Well, the picture says it all. Hand washing. We want to do water and soap for 20 seconds. You can sing the happy birthday song, or like our wonderful Dr. Smog says, sing the BIBLE song twice, and you're good to go. We have to teach our children and even ourselves to get into this habit. Don't touch your face, don't touch your face, don't touch your face. And before you eat or drink or touch your face, wash your hands. Wash your hands with hand sanitizer if soap and water is not available. All right, hand sanitizer is usually 60 to 70% alcohol base, and that is good. You just rub the sanitizer in your hands until it dries up, which happens pretty quickly, and then you're good to go. We can do this as you come and go from a classroom to another classroom, etc. At home, when we come from home, anytime you get a chance, it's just good to get into a habit of doing that. Wash your hands, wash your hands, wash your hands is the preventive. There's nothing else that is as effective as washing your hands. Other things also, as we have spoken about, avoid touching your face, mouth, nose, and eyes. Don't do that. Stay at home when you're sick. We don't want to expose others to potential symptoms that might be indicative of COVID-19. Again, most of the time they will not be, but we never know. So stay at home if you're sick. Again, re-emphasizing, do not share cups, utensil, and food because you don't need 10 minutes for this. You just need to drink and share the utensil once. And if the person is infected, you have just put that into your mouth. Maintain social distance. The droplets, medical studies have shown they don't travel more than 6 feet for the most part. So keeping that social distancing, especially when people around you, you don't know, you're not familiar with, you don't know if they're sick, if they're not sick. The social distance is 6 feet. Thankfully, for our younger age group, the elementary, there is such a low risk of getting any of this that a 3-foot distance is not going to add or decrease the risk any further as compared to 6 feet. And that is been put out by the American Academy of Pediatrics. However, for the middle school, high school children and us adults, keep a distance of 6 feet from those you do not know. And wear a face covering to protect others when not able to social distance. Remember that face coverings are not to protect you from getting a virus, but are to protect others from you spreading the virus to them in the event that you're contaminated. We want to decrease the opportunity of saliva flying, the cough or sneeze flying away from you onto others. So wearing a face covering, especially when you're not able to social distance, is actually very useful to prevent you from spreading the virus to others. Passing someone, just passing by, remember, it's not considered an exposure. You actually, if you're not wearing a mask, you actually have to be in contact with a person for more than 10 minutes to be at any significant risk. So here is a summary, a wrap-up. Transmission is through contaminated respiratory droplets. What do we do to prevent it? We wash our hands, we wash our hands, we wash our hands. We don't touch our face. And when we're going to eat, we must wash our hands. Or when we're going to touch our face, we must sanitize our hands in order to prevent entry of this virus into us. When the kids come home, of course, our risk is, are our children going to bring this virus home to our loved ones at home? And that is a very good concern. And of course, something that can definitely happen. So what you want to do is you want to have your child stop everything and go directly to wash their hands as soon as they get home. And that applies to even all of us when we go home. If they bring their backpacks, their shoes, etc., yes, they can be contaminated, I guess, but you need to remember, just the objects themselves being contaminated is not going to automatically give you COVID-19. What you have to do is apply the rule for everyone at home. When you touch something you're not sure of, or at home, or when you come from outside, just wash your hands and prevent entry by not touching your face or eating before you wash your hands. That is something that we all need to practice, and it's something that's going to help us keep everyone healthy at home. So do not let fear or anxiety overwhelm you. Remember, God is sovereign. He takes care of you and will take care of your children and will take care of your household. So let's be encouraged and let's move forward with peace. Thank you, Lisa. This is all I have to offer today. I'm sure if anything changes, TCS will be right there to bring any updates to our wonderful TCS family.
Thank you, Gladibel. We are so grateful for your presentation today. Thank you for just making it so clear and letting us know the ways we can make sure our families are safe. Thank you and God bless.
Thank you.